Yeah, a lot of people ask me, Lisa, why in the hell do you want to get involved in politics? And the answer is really simple, because I want to be a public servant. I want to serve all of you, and I want to serve everyone, whether they voted for me or not, whether they believe in what I'm doing or don't believe in what I'm doing. I believe that's exactly the definition of a public servant, is to serve the public. So one of the really hot topics right now is, one of the pieces on my platform is healthcare. And right now we know the government is all shut down over healthcare. And there's a big fat lie and play on words going on right now that the president and vice president are playing a big fat game. And they're trying to trick you into thinking that the Democrats really want to give healthcare away to illegal immigrants. Okay. Do we really want to do that? And they really want to do that at our expense? Well, it's really a trick, and it's a play on words. And what they really want to do is cost Americans hundreds of thousands of dollars for their health insurance. So yes, some migrants, they get health benefits, but they are not illegal immigrants. They are considered lawfully present. They are here on work visas, they are DACA recipients, they are refugees and asylum seekers. They are following the rules. They are paying taxes. 1.4 million of them were stripped of their health care with the passing of the big, abominable, ugly bill. So the Democrats are fighting to restore those cuts. Illegals is what they're calling them. They can only get, they're undocumented, but they're calling them illegals. They can only get emergency room care. Medicare, Medicaid, they cannot qualify for. They can only get emergency room care. That is only a fraction of the total health care bill, which is 1% of the total health care expenses. They can't get ACA subsidies, and they can't get anything. That is federal law since 1996. So nothing has changed. And here's what's going to happen. Premiums will jump 75% for all Americans. That's what they're fighting for. So it's not health care for illegals. They're playing a trick on you, and they're playing a trick on words. My other part of my platform is affordable childcare. Right now, our New Jersey state budget has a shortfall of like $30 million. It needs to be, there's plenty of money there. Part of the job of the governor and the legislature is the budget. That is the biggest job, and it needs to be managed better. Working families in New Jersey, 1 in 5 adults with children can't find affordable child care. There are subsidies out there, but they make too much to qualify, but not enough to get it for free. More parents working will add $3.6 billion per year through increased wages, tax revenue, and employee productivity. So why wouldn't you invest in child care? Early learning builds brains and promotes lifelong learning, health, and well-being, reduces long-term spending on special education, healthcare, and social services. So it's better for the economy, it's better for parents, it's better for the children, it just makes sense. This is another thing that I am advocating for. I belong to an organization called StartStrongNewJersey.org. They have a plan worked out regardless of who becomes the governor. I just attended a luncheon with them. They had both Chitterelli there, and they had also Mikey Sherrill was not able to go, but Dale was able to go, and Dale and Mikey have pledged to support this plan. New Mexico offers free child care, and so does Connecticut. And they are working with the people in New Jersey to help us figure, we can do this, and there is a way to do it, but we could do it Jersey style. This is something I would advocate for and fight for because it makes sense for New Jersey. Thank you so much. ballot, column B, vote for me, vote for Rosalie. Hey, I made a run. And donate to us generously because the Republicans have all the money, we don't.